what causes autoimmunity? Hi, I'm Dr. Mona Morstein. Welcome to my channel. Today I'm going to talk about what is Hashimoto's disease. Now, if you haven't already subscribed to my channel, please click below. What is Hashimoto's disease? Well, Hashimoto's full name is Hashimoto's thyroiditis, and this is an autoimmune disease. Now, an autoimmune disease means for some reason your own immune system is attacking aspects of your own thyroid. And this over time can damage it and lead to you developing hypothyroidism or a poorly functioning thyroid. Now, what causes autoimmunity? Well, many things. One, you do have to have a gene that says, I can get Hashimoto's thyroiditis. But if you're born with that gene, what all of a sudden one Thursday made it turn on so that this attack is now happening? Well, there are several things that we know epigenetically can initiate autoimmunity. One is having a bad diet, a diet that's unhealthy, a junk food, fast food, GMO food, all different kind of low nutrient foods is an oxidative damage problem to the body and just sets it off into potentially developing many conditions, including autoimmunity. Two, the nutrient deficiencies that come in that regard, particularly vitamin D and omega-3 oils. We know for sure that those have an association with causing or having a person have a higher risk of an autoimmune disease when they're low, right? And vitamin D3 deficiency is pretty common, and omega-3s are very common because most people's diets, and I do a diet diary for a week on every patient that walks in my clinic, and literally the vast majority are just not getting omega-3 foods in. So nutrient deficiencies as well as other ones as well. Also, celiac disease. Now, celiac disease is associated with Hashimoto's with, depending on the study, between 8 and maybe 13% of patients who develop Hashimoto's have celiac disease. Now, celiac disease happens when you eat gluten, and it causes an autoimmune reaction in your small intestine. But that can be a signal to start other autoimmune diseases like Hashimoto's and type 1 diabetes. But many people, most, don't have celiac disease, but they still may have food sensitivities that are not initiating celiac, but eating foods that you're sensitive to can make the immune system just overreactive, and then all of a sudden, if they get confused, have them start attacking one part of your body. So we always want to do a food sensitivity test. Even gluten, if you don't have celiac disease, has some association with aggravating the thyroid. However, if gluten is just not reactive in you at all, and the food sensitivity test shows that, but instead for you, it's corn or dairy or eggs or soy or whatever, we want to find that individual food which is upsetting your individual body, right? Another thing that initiates autoimmunity is an unhealthy gut microbiome and or leaky gut. There are actually bacteria in the gut, if they've overgrown, like Yersinia, which cause what's called molecular mimicry. That means that your immune system is looking at that overgrown bug in your gut and go, I should attack that. And by chance, there's a protein in your body that's closely related to a protein on that gut bug. And that can start causing the immune system to get confused and attack that organ. So looking at the gut microbiome and the functioning of the gut is important. Also, unhealthy environmental toxins are definitely associated with being a risk factor for autoimmune disease. And that can be mold, mycotoxins, chemicals, and toxic metals. So if a person has an experience in their life of having lived in a moldy house or a moldy dorm, or they're a mechanic and work around chemicals and solvents, or they're a farmer, but not organic farmer, these are ways that they could be even more exposed to toxins that we're all exposed to, all of us, right? But if it seems to be important for that patient, we need to analyze that. And the last is emotional trauma, because mind-body is something really happens on an emotional level. It can play out in wearing down or breaking down some aspect of the physical body. Now, how do we diagnose Hashimoto's? Well, we do that through just regular labs. We're going to measure thyroid peroxidase and thyroglobulin antibodies. Now, thyroid peroxidase is an enzyme, oxidizes iodine to stick it to tyrosine on the foundational protein, which is called thyroglobulin, in the thyroid cell. So the immune system can either attack that enzyme, so we can't put the iodine on and make thyroid hormone, or it can attack the actual thyroglobulin molecule and destroy that foundational stone upon which the hormone is built. Either way, if those antibodies are pretty high, it's a real problem to the thyroid over time. And then, of course, we want to measure the thyroid stimulating hormone from the pituitary, free T3 and free T4. And these will be ways for us to analyze how well is that thyroid standing up to the autoimmune attack. Now, if hypothyroidism happens, we generally have a higher TSH and lower free T3 and free T4. And that's usually combined with a patient saying, I'm cold, I'm tired, I have dry skin, dry hair, I'm losing my hair, I can't concentrate, I have weight gain, water retention, constipation, I have problems with my period, they're heavy, they're happening too often, I'm depressed. Have you ever had symptoms like that, right? Those are not uncommon symptoms, and hypothyroidism is not an uncommon problem. So it's good to know that maybe sometimes if you're having 1 or 2 or 3 or 4 of those symptoms, you should be tested for Hashimoto's thyroiditis. One last thing, if those antibodies are high, low-dose naltrexone can be used to help bring the autoimmune reaction down. And I've seen lab by lab lower and lower thyroid antibodies using correctly low-dose naltrexone. Now, I have another video that you can look at on how I actually do treat hypothyroidism itself when it does happen. And thank you for watching this talk on Hashimoto's, a fairly common autoimmune disease that harms the thyroid long term. If you like this talk, please click the like button and subscribe to the channel. If you would like to have a free download from me or schedule an appointment, check out my bio and click on the links below. Thank you.